So let me try that again. Normally when workshops are coming from the CTL, there should be very active and we want people to be involved. And so that's what the purpose of this worksheet is. And if you could look at that in your Word document while I'm talking, or if you wanted to print it out, that's fine. This will serve as a review for you of the things that we're talking about, but also has some extension activities in there as well. So Dave, can you give me a thumbs up if you were able to get the email that had this attached to it? Great, great. Well, I'm just going to move on forward. So this workshop is split into two parts. The first part is meat and potatoes. We're going to talk specifically about what are the guidelines at Cincinnati State, how do we follow them. I'm actually going to demo some masks. We're going to talk about hand washing and sterilization and do that work. The second half, which is the last half hour or so of this workshop, is an introduction into reframing our view, looking at compliance and classroom management in the time of COVID, and also thinking about how we want to restructure the way we're building our classes and how we approach our students and ourselves really as we move into fall. All right, well, let's get started. I'm going to go ahead and share my screen, and we should be able to see what I see. So let's go all the way back. All right, so my first question is, can you still see me on the screen? And you can just answer yes or thumbs up.
Yeah, I see you and the screen share.
That's great, thanks, Bob. Okay, and Dave, same for you. Oh, and Laura Morris is here. So thank you, Dave. Let's go ahead and give her an ad. I'm going to be going through your PowerPoints. I'm going to have some video. At the end of our workshop, I will provide you with your certificate for today, as well as the PowerPoint, which includes all of the links. Hi, Dr. Morris, welcome. But I'm also going to encourage you all to watch the shorter videos that are posted right now at the COVID-19 faculty resource site, where I interview Mike Cheney, who is a respiratory therapist and the head of our respiratory care program at Cincinnati State. He's been a practitioner for 27 years, and he's currently working with COVID patients each week. So I would encourage you to go there for a small refresher or for a bit more detailed information about the science. And we have a chemist with us tonight. So actually, Dr. Morris may be able to help me as I describe some of the chemistry pieces that I'm going to talk about tonight a little bit. All right. So moving along, there we go. So our objectives for this first part, which again is going to be pretty meat and potatoes, is like direct, and I'm going to kind of lay on you what our guidelines are. So I apologize, this is probably going to be a little less active than what you're used to from the CTL, but we want to clearly understand what the Cincinnati State guidelines are for all employees and all on-campus activities, and we want to describe different types of PPE. Now, I know that many of you have read a lot of things, you're wearing masks, you're doing this. So my purpose of going through and demoing these things is just to make sure that everybody's had an opportunity to hear it. So our guidelines for campus specifically are for face-to-face teaching, working on campus. But working on campus would include everything from coming for a meeting with a student, working in your office, any reason why you're going to be on a Cincinnati State property, these guidelines are in place for you. So I want to start by saying that our role is as model. And our role is as model or role model all the time anyway. Who's willing to share with me something that we already do that is modeling for our students, even prior to COVID pandemic and other things that are going on right now?
I wear goggles in the lab.
Perfect. Yeah, so anything else? Bob, how about you with your classes? Or
Yeah, certainly brewing, following safety protocols, because we're working with a lot of, hot liquids and so forth.
Yeah.
Safety
Right.
glasses, yeah.
So what we are doing all the time, and I would go even further to say we model professionalism in the way that we email students. We model how to talk to each other, and when we congregate. We are constantly modeling for our students. They're noticing how we behave and what we do. This is no different. Anything worth doing is worth doing correctly, because imagine that you are a model for students and others as you are walking through this time. So when we follow these guidelines, I want you to kind of think of it as, okay, well, I'm modeling the behavior that I expect my students and others to mirror and mimic. And, you know, I take that job seriously. So just keep that in mind. And I think that these are serious times. People are afraid. There's tension, there's anxiety. We're going to see it in our students. We're going to see it in each other. So yeah, having a plan together, which is what we're going to talk about, is really good. So all right, jumping in then to the 4 basic things. You agree that you're going to check your personal data. You're going to wear a mask properly at all times, except for when you're eating and drinking. You're going to have proper hygiene, and we're going to distance. Now, what do I mean by check personal data? Anybody have any ideas what that might mean? Or I've got some scientists in the room, so that makes it easier.
I assume that's contact information and phone numbers, that kind of thing, yeah?
Yeah, so you're the second person that said that. So what I mean by check personal data, what I meant by it, that's where an asterisk there is, know, how do I feel today? What's my baseline, right? But in addition to that, Bob, yes, that's a very good point. We might want to remind our students and make sure that we ourselves have our contact information properly updated in my services. So that's a definite thing. But the reason why I bring up the check personal data thing is because I'm not sure about you, but I'm the kind of person pre-COVID that if I had sniffles, I wasn't feeling 100%, that didn't mean I wasn't going to work. And it doesn't mean I wasn't pushing through. I'm not saying that's the right way to be. I'm just saying that quite a lot of our faculty and employees are this way. That is no longer, that cannot be our standard anymore. At this point, if you have a fever, chills, a fever over 100.4, chills, aches, body pains, if you have difficulty breathing, mild or moderate, if you have a new or worsening cough, if you have a sore throat, if you've recently vomited or have diarrhea, or if you have any aching throughout the body, you're not to come to campus. Now, we're going to talk about the policy for what to do. But the reason why I brought up the check personal data is because when I wake up in the morning, I don't often stop and say to myself, how am I feeling today? And check my vitals, you know? But we're in a place now where we kind of have to do that. We have to say, how am I feeling today? Do I have any of these things? And if I do, is it just one of these things, or do I have more? This is important because this virus is highly virulent and it's super nasty. Some people are asymptomatic. Some people have mild symptoms. Some people have severe symptoms. So if you have any one or multiples of these, that should be your trigger. Hey, something might be going on and I should pay attention. So that means we have to pay attention a little bit more often to how we feel when we're well is also. So the evidence of any of these symptoms should prompt you to contact your physician, and then it will prevent you from coming to campus. Now, at that point, you either come back to campus with a release from your doctor, or if you have not experienced the same symptoms that you had for 72 hours straight, for 3 days, if the symptoms that prevented you or made you think you might be ill are gone, you may return to campus. Also upon with the recommendation from a physician. So that's our general rule for your illness, how you're feeling. And this is a little bit different than quarantine, which we're going to do next. But I'm going to pause here and say, please note that I have provided you with the links to the Cincinnati State guidelines for your responsibility, mask protocol, and student responsibility. It's in your ticket to this workshop. It's here on this PowerPoint that you'll receive. It's on the COVID-19 faculty or Cincinnati State site as well. So you have access to this document in several different places. So if you're ill, contact your doctor, and you may not return unless you do not have those symptoms for 72 hours and or doctor's note. But quarantine's a little different. So quarantine is if I have been in direct contact with an individual who is now tested positive for COVID, or in contact with someone who is in contact, you know how this works, then I must quarantine for 14 days. The easier way to think about this is if there's any possibility that I have had definitive exposure to COVID-19, I have to quarantine for 14 days. At this point, you need to contact your supervisor and or human resources, and they will give you guidance on how you return to work. And I'm going to come back to this in the second part of the workshop, but I'm just going to briefly say here, you're going to hear me say over and over again, plan, plan, plan. Plan for something in case you are ill. Plan for something in case you have to quarantine. Work with your program chair or your dean to share those plans to determine that that's sanctioned and okay. For example, in case I had to quarantine, if I was teaching a face-to-face class in the fall, I may build up a live web or substitute or figure out how I was going to get those classes taught in the event that I had to quarantine. So right now, planning is king. It's an important thing for us to think about doing. So what is it that you're actually agreeing to do? You are agreeing to wear a face covering that encloses your mouth, your nose, and your chin securely the entire time that you're on campus, with the exception of eating or drinking. You're also agreeing to practice proper hand washing and sterilization, so hand hygiene and sterilization while you're on campus. Whatever the mask is that you're wearing, you agree to launder, clean, or sterilize it in between daily uses when coming on campus. You will not reuse a medical disposable mask, and you're going to avoid touching your eyes, nose, mouth when we have the face covering on. Okay, now I'm going to stop sharing for just a moment so you guys can see me in a larger view, and I'm going to demo some face masks, right? This is why you're all here. Okay, so on the COVID-19 faculty resource Blackboard site, there are several videos that you can watch that I have with Mike Cheney that goes through these as well. I'm going to go through 4 different types of masks with you and just talk about some of the logistics. So the first one that I'm going to go over with you is a cloth mask. It looks like this. It has 2 sides to it. On the edge of it, it has elastic. And one of the things I'm going to do is turn off my background briefly. And I'll turn it back on in a minute so that you can see me a little bit better. Okay, because it doesn't like the green screen. In addition to this, it has a pouch here. Now this was made for me. They're all around. You can get them for $5. You can make them yourself. But this is what they mean when they talk about a cloth mask. What are the types that there are? Now, I'm going to wash my hands thoroughly using the proper techniques that we'll talk about after mask demoing. And then I'm going to put my mask on by holding the edges here. I'm going to try to avoid touching too much, just sort of pull it down. Make sure this is nice and tight on my nose. Now, you might notice that the mask is above my ear and below. That is the proper way to wear your mask. Now, I use my ponytail or bun or whatever I have to hold it in place. Some people do headbands with buttons on them that they can hold it in place. I actually have kind of a small head. So these masks are hard for me to keep on my head unless I have something to sort of hook it on. I have also seen people do small things on their glasses that hang down that allow them a button or a binder clip that allow them to hook their mask around that. Now this is a cloth mask. So what is it doing? Well, it's protecting you from me. The droplets, which are larger respiratory expulsions that are leaving my mouth, are going to be prevented from going into airspace as a result of this cloth mask. But aerosol particles that are very, very small are still going to travel in and out. Droplets can still travel. It's just a numbers game at this point, and we're reducing the amount of potentially infectious droplets that can be found outside of my mouth. So if I'm wearing a mask, Dr. Morris is wearing a mask, then we're reducing the number of potential droplets that can be found between us in the air. Now, when I go to take off my mask, I'm going to, again, make sure that I thoroughly, properly wash my hands and or sterilize, and then I'm going to pull it off by using the edges here. Now, what I like to do is flip it into itself, just like that, and then I'm going to put this in my pocket. What I'm not going to do is put this on a table or a bench or a desk or a podium, because doing that means that I'm touching another surface. So although it's not ideal to put a mask in your pocket and take it out and put it in and take it out, if I designate a pocket, that's what I'm going to do. I'm going to keep it closed, so the interior of the face mask is touching itself and not much else. And then I'm going to make sure I wash my hands and I use proper hand hygiene and sterilization techniques every time. I think that's the best we can do. Remember, you're taking your mask off only to eat or drink. You're not taking your mask off in any other cases. So, that's the plan there. Now, does anybody have any questions about that cloth mask demo? Really exciting, I know. All right.
I have a little bit of a question. So I thought that the rule was that if you're in a room by yourself, you can take your mask off. Is that correct or not?
No, the guidelines clearly state that you agree to wear a mask when you're on campus, except for when you're eating and drinking.
Huh. Okay. Because
But if you were in your office
Mhm.
and your door was closed, I'm not sure how I would know you weren't wearing a mask.
I was on the safety committee when we reviewed this, and I was pretty sure that it was 4 walls. So if you're in a cubicle, you can't take it off. But if you're enclosed by yourself in a room, because we do, obviously, when we're in the lab taping, take them off. I won't if you don't want me to, but
In the lab?
when I'm by myself taping a video there, yep, I do.
Oh, taping a video. I see. I didn't hear that first part.
Mhm.
Well, Dr. Morris, all I can tell you is that I built this workshop based on the paperwork that I received from HR and the guidelines that we have.
I may not have the latest copy then, so I'll go back and look. Thank you.
You know what? I want to pull it up because I want to make sure. Because there was, to be fair, there was a revision that came out late last week. And I'm going to pull up just the mask protocol. Can you all see what I'm seeing?
Nope.
All right. You can't see it, even though I'm sharing it?
I don't think so.
You're just seeing the PowerPoint.
Yeah.
Okay. So, Dr. Morris, you are correct. I see this correction here.
It says common areas, classrooms, restrooms, or presence of others,
There
right?
you go.
Okay.
This is what
All right.
what we got. So yeah, blah blah blah. Faces a waiver. Da, da, da. Yeah. So I guess that is the only difference from what I'm saying and what's here, which is sitting alone in an enclosed workspace or vehicle.
Right.
Yeah.
Okay. All right. That's good.
No, I'm really glad that you brought that up, because that came out, and I think one of the things I've been doing is, I've been running around trying to keep track of everything. So I'm really glad. So to be clear, you will, and I guess my point earlier was that, no one knows if you're alone, I will say though that, if you're doing that in a space where students have just recently been and it hasn't been environmentally cleaned, you might want to reconsider.
Right. I would.
Okay, so Dave, will we be provided any masks? He's asking. Yes, I believe we will. I do believe that there are going to be branded face coverings available. I just don't know enough about distribution or when those will be available.
They're in our mailboxes.
There you go. All right. Okay, so let's move on to the next mask, and thank you for that. I'll have to make that correction on the COVID Faculty 9 site as well. All right. So this is a neoprene mask. Now I bought this for $9.98. It's designed for athletes that have asthma or allergies, and when they're bicycling or whatever exercise they're doing. So this mask has a filter inside, and it has 2 one-way respirator valves. This is not, again, protecting me at all, but it is reducing the amount of droplets, obviously, that leave. Now, I'll tell you what, I'm going to put this mask on, and I'm going to tell you why I really like it. Again, everybody has their own unique things, and my head is pretty small, and I struggle unless I have a kid-sized thing here. So I'm going to wash my hands and sterilize them as I normally would. I'm going to pick up my mask at the edges, and this one has Velcro. So I'm going to Velcro that around my face. Now you'll notice that right now I'm demoing, so I'm pointing and touching and doing all that. When I'm wearing a mask normally, I'm going to really try to prevent touching my face in any way. This has a much more distinct metal band at the top. And the only thing I will say is if I'm wearing earrings, I got to pull the earrings out because they get stuck in there. I like this fit. It feels good to me, this neoprene. And so, I'm a fan of this. But again, I'm preventing myself and the droplets that may be infectious from my mouth from going out either far distances, and I'm reducing the number of those that are leaving my space and potentially being available for others to breathe in. So just as an aside. So this one is not a mask that I could launder like this one. Okay. But I also like it because when you pull it off, it just kind of collapses nicely onto itself. When you purchase these, they often come with a set of filters like this that are replaceable inside. And I find that to be comfortable. Regardless, any mask I'm wearing, I'm giving myself a facial, right? I mean, it's just, I'm rebreathing my own air. Well, I'm rebreathing air, but I'm rebreathing. And so my coffee or whatever I drank or ate, so just keep that in mind. It's lasting a long time. That neoprene mask, you could certainly wash it, hand wash it. I wouldn't launder it, but I could hand wash it. And there's one other question. It's 7:29. I actually forgot to ask all of you. The workshop's been going a little long. Does anyone have a hard stop at 8:30? No? Okay. I don't think, because we're such a small group, that will happen, because there's not a tremendous amount of discussion that we're doing yet. But if I go a little bit over, it'll be about 10 minutes or so. We'll just see. It's about watching videos and some other stuff. Okay. Now, I mentioned to you a while back that in this cloth mask, I had an opening here. That opening could house a 2.5 micron filter. So I do have these 2.5 micron filters, and I can actually set those inside of my mask. Now, this will offer me a small amount of protection in this cloth mask, this filter inside. And it's pretty easy. Now, this cannot be laundered. But I'll talk about how we can sterilize those in a little bit. I happen to be a person in a susceptible population. I have an endocrine disorder, and so I have an N95 mask, which is a small N95. This is a 2.4 micron. N99s, I think, are 4.4. And if you're not familiar, micron is referring to the size of the pores or the holes of the particles that can make its way through the material. So N95 is referring to that this is going to block out 95% of particles that I'm going to be breathing in potentially. So this mask is protecting me a bit in addition to protecting you. Again, we want to put the mask on around our head, above and below our ear, making sure that whatever mask we're wearing is completely covering our chin down here at the bottom. Now, the CDC guidelines recommend that you do this above and below your ear. You are not to cross these. Crossing these, I see some people doing that, is against the CDC guidelines. I think, if I were to venture a guess, it has to do with potentially creating a gap here where this is already kind of snug. This has metal in it on the top, and I'm completely covered on the side. Now, I know I look like a duck. This is a duckbill kind. They have non-duckbill kinds that are sort of hexagonal or hexagons around. I feel really comfortable in this mask. It does give me a lot of space to breathe. One of the questions I get sometimes is, well, wait a minute, I'm going to have less oxygen, or I'm going to be rebreathing carbon dioxide. No, this is not a concern. I have more than enough oxygen coming in. I'm perfectly fine breathing in this mask. I don't have any conditions that would allow me to feel like I have trouble. Now, would I want to go run a marathon wearing this mask? No, I wouldn't. That would be difficult, I think, but you have to get used to those things. But yeah, this is perfectly comfortable for me. So this is protecting me a bit from you, and it's certainly protecting you from me. Again, I'm going to sterilize my hands. As I go to take the mask off, it flips itself down just like this and off. Now, one of the things I try to keep in mind is that I want the inside of my mask only to touch the inside of the mask or my face. So sometimes I'll see people and they'll have their mask on and they'll go to say or do or drink or something, and they just sort of pull it down. They'll go from properly wearing their mask to something like this. I highly recommend that you don't do that, because as I'm here, all of this is unprotected space. So when I pull my interior of my mask down, what am I doing? I'm touching all of this space that was unprotected previously with my mask. Does that make sense? Yeah. So can I get a thumbs up? Oh, there she is. Nancy's joined us, so that's great. Okay, so we have everybody. That's awesome. Nancy, welcome. So the other thing I would like to say is I don't have a medical mask with me, but you've all seen those. If you wear a medical mask, you can use that for your time on campus, but those are not to be reused. They are designed to be disposable. And so if you are wearing a medical mask, please dispose of it at the end of the day and wear a new one. The other thing is cloth covering is all that's required. So we might see our students in some interesting things. You've seen on YouTube that people are making masks out of socks and other things. Our guidelines say you have to wear a cloth mask. They don't indicate specifically how or what kind. And so just keep in mind that our students may have some interesting things going on, bandanas and whatnot. So let's talk about sterilization then. How do I take care of cleaning these masks? Well, launder is fine. If it's cloth, you can launder it, that's no problem. But what if it isn't cloth? What can I do with like the filters that are inside of my cloth mask, for example? Does anybody have any ideas what to do about that?
Heat them.
Yes, that's right. So I actually invested on Amazon. I bought a $25 sterilization UV box. And it's really great because I can plug it in into an electrical outlet. I can also plug it into my car. I can put my phone, my pens, my dry erase markers, my keys, my masks, and my filters in that. It takes 3 to 5 minutes for it to sterilize everything. Now, the ones at the hospital actually are like 45 seconds and everything's done. This is not a requirement. No one is telling you that you are required to purchase a UV sterilization box. However, UV light is one way in which we can sterilize our masks. So I could put this in direct sunlight, but I cannot tell you how long it would take in direct sunlight for it to get fully sterilized, because we have clouds, we have filtration, the sun's coming down, but that is one way to do it. The other way to do it is to use a diluted Clorox solution, and this is where the chemist in the room will agree or disagree with me. So when I worked at the Cincinnati Zoo, I worked there for 6 years, we used diluted Clorox to clean our animal containers, because when it evaporated, right, there is a reduction of the chemical component that happens as soon as it is fully air dried. Is that correct, Dr. Morris?
Yes, probably. So I would say as long as you can smell it still, you would not want to reuse it, because that's chlorine gas.
That's right. But as soon as it's completely evaporated, it's gone. And I can just tell you from all those years of working at the zoo, as soon as it was dry, you had no smell.
Right.
There.
Now
So
there's something you could do, set it in the sun. So use your dilute Clorox and then set it in the sun. That would make it go away faster.
You know what? That would be fantastic. But in general, yes, if you can smell that, then you don't, it's still present. But once it's fully evaporated, it's not there anymore, and you have a sterilized product. Now, the other thing you could do is alcohol. So people are spraying their things with alcohol. Now, I personally am not a huge fan of this. That smell really does bother me that close to my face. And that's another reason why I personally invested in the UV sterilization box for the price of it. I have noticed, someone was asking me about it today, that the prices have gone up a little from when I purchased it. But I guess you can certainly search around, find them. Okay, so that's how we sterilize our masks. So is everybody okay with that? You can just give me a thumbs up, or does anybody have any questions about, thank you, Bob, about mask wearing? All right. So let's talk about social distancing, and then I'm going to talk about hand hygiene. Actually, let me talk about hand hygiene first. So let me do that. Okay, so I know that you all know all of this. So this is just making sure that we're all in agreement that this is the best practice. So when I'm going to wash my hands, I'm going to fully lather with soap and water. I'm going to cover my entire skin. I'm going to make sure that I'm going in and out of my fingers, and I'm going to count to 20 seconds, or I'm going to sing the happy birthday song, or twinkle, twinkle, little star, or whatever it is I need to do to get to 20 seconds. So then I'm going to thoroughly rinse my hands. I'm going to wash that pathogen down the drain. So I have both mechanical movement as well as the soap itself breaking apart, hopefully the outer coverings of pathogens and other biofilm that I have on my hands. So 20 seconds is the minimum. Now at that point, you can dry your hands with paper towels if you want to and throw them away. You can air dry your hands as well. Now, the minute we're done washing our hands and we go moving around again or touching things, right, we're still going to pick things up. So repeated hand washing throughout the day is very important. The other thing I'll mention is I want to talk about Purell and hand sanitizers and alcohol-based hand sanitizers. So when you're using an alcohol-based hand sanitizer, it's really important that you have enough product to get your hands completely and thoroughly wet with the hand sanitizer. So it's not a small amount. It's actually quite a large amount. And you still want to use it for 20 seconds, physically moving your hands in and out, just like I'm doing here. At this point, though, if you use hand sanitizer, do not then wipe your hands. They must air dry in order to get the full effect. Now, in both of these cases, the one place of our hands that possibly carries the most potential for pathogens is under our nail bed. So I have hardly any nails here, but under my nail bed is where I'm going to carry certain things. So as a result of that, I do a few things. And I'm sorry if you hear the dogs going crazy back there. We're going to break in just a minute. So that's a Great Dane and an Aussie door. So when they get each other going, they get going. On the inside of my nail bed, what am I going to do? Well, in my purse, I have a small little brush that I bought. I think it was $1 at Walgreens, and I just carry it with me. I have a Ziploc bag with these things, or I just carry it with me. Now, Ziploc bags are not recommended, so we'll talk about that in a few minutes. But in my purse or my backpack, when I go into the restroom, I use that. But I also use it with Purell. Let's say I don't have that. I could lather soap and water in the palm of my hand, or I could have a small amount of hand sanitizer there by scratching my palm and just physically moving underneath my nails quickly with other nails. You're getting at that place that is kind of the sensitive area for maintaining. Now, in either of these cases, nothing's going to be perfect. We want to try to do it the right way possible and be thorough, and that is what we're committing to do. When we come on campus, we're agreeing to these responsibilities that we have, and so as a role model for ourselves and for others, we want to make sure that we do things as thoroughly as we can. All right, I'm going to pause there for a minute on hand washing, hand hygiene, masks, laundry, and sterilization, and say, do we have any questions before I move forward into social distancing? Have I left anything out that you think is important to touch on? Okay. You guys are a great crew for the evening. Let's talk about social distancing. In order to do that, of course, being a biologist, I want to talk a little bit about science. Right now, pardon me as I cough, on cue, right now, we know that droplets that leave my mouth could potentially be infectious. Droplets are larger molecules that come out of my mouth and respiratory system. So when I'm wearing a mask, what I'm really doing is preventing those droplets from moving outside of my mouth, and lots of them are being caught in the mask and therefore not going into the space between us. Some will, but not all. However, aerosol, which are really tiny particles that can leave your mouth, are much smaller. Right now, COVID-19, we don't have any definitive evidence that it is transmitted through aerosol. We just know that it's transmitted through droplets. Now, that may change over time because there's definitely some anecdotal evidence that is coming out, but we don't right now have that. So we know that COVID droplets are potentially infectious. But those droplets being larger, they leave your mouth and they kind of drop down. The aerosol portions will go out and they kind of hang in a cloud for a longer period of time because they're smaller, right? So 6 feet of distancing, or a minimum of 6 feet of distancing, is going to help reduce the number of potentially infectious droplets that you may encounter, the larger particles. Wearing a mask reduces that even further. So we are agreeing that when we are on campus that we are going to social distance. We're going to maintain the proper distance of at least 6 feet between each other, maybe larger. We're not going to congregate in groups. We are going to make sure that we're hugging and shaking hands, not hugging and shaking hands. I'm sorry, I'm using my elbow bump here. I don't even like that because I can't elbow bump you if I'm 6 feet away from you, right? So think about your perimeter of 6 feet, your individual 6 foot space, and that's what we want to try to maintain at all times, whether we're teaching, meeting with students, or meeting with others, peers, faculty, administration, all of those things. So the only other thing that's here that I haven't really talked about is making sure that when we're using technology and other things on campus, that we're thoughtful about that. Now, our spaces are going to be environmentally cleaned and controlled. Campus police and others are posting the maximum number of occupants that you can have in a given space, elevator, room. So make sure you're reading all of those signs and adhering to them for each space on campus. But even with all of that, if it were me and I'm coming to campus in the fall, I'm going to have a little kit in my backpack. And in that kit, I'm going to have my brush for my fingers. I'm probably going to bring my sterilization box, which, by the way, is about this big, which fits right in my backpack and can plug in. I'm also going to bring my mask. I'm going to bring my own hand sanitizer, and I'm going to carry those things with me. I'm likely going to bring Clorox wipes as well. With that said, even though our Kim Vasco is working so hard, and all of us on campus, they're all working to make sure that environments get clean between spaces. You don't know if somebody popped in there, a student popped in there individually on their own, or to study or something. And so I would highly recommend that you wipe down podiums with Clorox wipes, or that you are taking the time to clean surfaces that you plan to touch. I wouldn't use dry erase markers that were hanging around. I'd bring my own with me in my backpack, my own pens. So there's a lot that we can do by planning ahead that allows us to have consistency in the way that we're doing things, and thus reducing our stress a bit. Because if I know I have a plan in place, I'm going to feel more comfortable doing my job because I know that I've got these things that I need to do. Does anybody have any questions about that? No? Okay. Common sense a bit, right? All right. So the last thing that I'm going to do in this part one piece is I want to talk about, I already went through personal hygiene, so you can look at that on your own. Obviously we're not going to cough into our hands. We have a mask on anyway. But if you do not have a mask on, you're eating or drinking, or you're in an enclosed space with walls and doors by yourself, you want to cough into your arm and then throw those things properly away. All right. So let us then focus on the student statement of responsibility. So at this point, we've concluded the faculty requirements, employee requirements. Now I want to talk about the student personal statements, because I think we need to know. The student personal statement is very much similar to the faculty statement with a couple of exceptions. The same thing is true about their illnesses, so see a doctor and or 72 hours without those symptoms. The same thing is true with the quarantine policy, and this is good because it's the same policy all around. So there's no difference in what they do versus what we do if they have had potential exposure. What is different though is that in their personal statement, they have been given this statement: I understand that I will not be penalized by instructors for an absence related to COVID-19 illness and or self-quarantining, but I will need to talk to each of my instructors regarding arrangements for making up work. It also says, I understand that my instructor may require proof of the reason for my absence. All right, so now we kind of get to the point where we have to really, really think about making sure that our syllabi have statements that are very clear. Please talk to your program chairs and your deans of your divisions to see what those statements for your syllabi, to have them go through those statements you recommend for your syllabi. There may be one that comes out from your division that's more universal, that says this is what we're going to do as a division or program. The deans have to stand by these statements. So this is where we kind of get into the place where we have to have both more structure and more flexibility moving forward. It's just in different places. So I get questions like, well, what if a student says they need extensions because they're ill, but they're not giving me any more information? Well, it depends on whether you're teaching live web or whether you're face-to-face with that student. It depends on what the statement it says on your syllabus and how you adhere to that. They can be required to provide proof for the reasons for their absence, but in order to get the extensions for the work, but they may not tell you and just not take the extension, right? So we just have to kind of sort of think through all of this. One other thing I'd like to mention is it's really not okay to ask our students why they're not there. And when I say that, oftentimes instructors really balk at me. What do you mean it's not okay? Well, it's not. Our role is to say something like, Nancy, I noticed that Nancy, I noticed that you weren't in class. I just wanted to know if there's anything that you need or how I can support you. That I can say. And most of the time, our students way overshare with us anyway. They allocate way more information than we need. But if somebody's kind of disappeared or they've asked for an extension, they're not following the rules and they're not telling you, you have to tread lightly here because they don't have to tell you for whatever the reason may be. So just kind of keep that in mind. And that's sort of a more empathetic approach as opposed to, and I don't like that, how that feels. I want to know that my students are okay. I also want to know if I've been exposed. I want to know all this stuff. From what I understand, and Laura, you can tell me if this is true, they're working on some college-wide language for contact tracing, and if a person is in your class that has then said that they are now COVID positive and it was face-to-face. So I know that kind of stuff's in the works. Unmute yourself for me.
Yeah, I think that that's next meeting, which is Friday. I know that that's in the works. I don't know that they have like a universal statement or anything, but yeah.
I mean, I know that the provost and others I'm in the ART meetings, the academic response team meetings. We're all talking about this all the time. I would like everyone to remember that, this is a pandemic. This is not something we can control. It's happening pretty quickly. We're having to make big adjustments. So we sort of have to have grace, I think, for the people that are building these policies and procedures that we didn't need 6 months ago. And that we now absolutely need moving forward. But please continue to ask me questions and to ask questions of your program chair and your dean and send those things forward. But it's going to take some time to develop that work. Just like Laura, the safety group, how long it took you guys to develop your guidelines. The times involved, thinking is required. We have to think through these things, and people have to, lots of different diverse individuals have to be in the room to discuss them. All right. Any questions about the student responsibility sheets and what they're agreeing to do? Now they're checking a box before they register and also when they come on campus. So it is fair to assume that every student who walks on campus should have knowledge of this personal responsibility statement. Now there is a chance that a student who isn't registered or is coming to admissions to talk to someone who has not seen the statement, even though it's on the website and all of this. So, we'll talk a little bit later about how to deal with conflict management and compliance management. But just sort of keep in mind that somebody may not be able to recite this that much. So we've come to a point of a break, which I like to give for everybody. We have about 37 minutes remaining. So we're going to actually take a 5 to 6 minute break here. But when we do, in the worksheet that I emailed to all of you, I would like for you on the second page, there is an area that says compare and contrast teaching face-to-face and visiting campus. And I mean prior to COVID and after COVID. All I want you to do is just jot down some things here that you believe are different now than they were before. And it doesn't, doesn't matter what it is, just whatever comes to mind. And I would also like you to take a human break as well. Get yourself a nice glass of water or, whatever it is you need to get through our remaining 40 minutes that we have here. And I will be back as well. So I'm going to go ahead and pause, and I'll see you all in 5 or 6 minutes. So it is currently 7:53. Let's just say 8 o'clock. We'll come back at 8 o'clock. Thanks.